I want to talk about, I'm Dr. Mallikarjun once again. I'm just introducing myself. I am an intensive care specialist. Previously, I talked about hypoglycemia. Hypo means sugar coming down, sugar dropping down below 60 milligrams. That is, below 60 is dangerous to life. Diabetes. In diabetes, sugar falling below 60 is dangerous to life. That I already made a topic by name hypoglycemia. Today I am dealing with a subject called hyperglycemia. That means sugar going above 180, above 200. That is what I am going to deal with. See, most of the patients not only patients, relatives. Some relatives or friends who come to me and they come home, they chit chat together. Then I check their sugars. Usually, as a doctor, they ask me to check the sugar. Sometimes they don't even ask, but I check the sugar because he's a diabetic. I check the sugar. Then I say, your sugar is 350. They say, oh, no problem, our sugars are always above 300, 350, 360, 320, always, daily like that. I take a tablet, one tablet per day, and nothing happens to me. This is the dialogue, this is the reply given by friends or relatives to me. Really something to worry. I just definitely, a person like me definitely worries. What happens when your sugar levels are constantly high? That means above 200. Your fasting should not be more than 130, or your post lunch should not be more than 200. That is usual. And your HbA1c, this is HbA1c is another test. HbA1c is another test. They say every 3 months you have to get it done. That is actually what is HbA1c means. It is glycosylated hemoglobin. The glucose attached to hemoglobin is measured. This is an accurate test which exactly shows how is your diabetic level. So it should not be more than 7.5. It should not be more than 7.5. Maintain it around 7. It is very good. Don't go above 7.5. It is called hyperglycemia, means your sugar levels are above the normal levels. Okay. So what happens? See, as I told you, most of the friends say, for the long time I am having above 300 only, I am taking one tablet per day, nothing happens to me. Yes, nothing happens immediately. Only in one or two conditions nothing happens immediately. But what happens to them in long term is, first, the damage will be done to the kidneys. Both the kidneys, not single kidney, both the kidneys go into failure at a time. Both the kidneys go into renal failure. Kidney failure means your both kidneys have gone. That is important. Number one, that is called diabetic nephropathy. Number two, your heart slowly is weakening, very weak, very much weakening. Year by year, your heart is dying slowly. That is called diabetic cardiomyopathy. And one more thing, your limbs, upper limbs, lower limbs, mainly the lower limbs, they lose the blood supply. And the nervous system also is slowly, that's why you feel those tingling numbness. You don't have sensations over the feet. This is all happens. And once you sustain a small injury, then or a small scratch or something, from there the infection starts, and the leg or the hand goes into cellulitis. Cellulitis means swelling, infection, etc. We treat it with high sugars and insulin, etc., antibiotics, insulin. But still, in some conditions, there are conditions where we remove the foot. We do amputation of the limbs only because of high diabetes and uncontrolled cellulitis, the infection spreading. So we had to amputate the limbs. So be very cautious about this. And another important thing is your eyes, particularly the retina. Your retina in the eye is very sensitive. So there is one condition called diabetic retinopathy, where your retina is damaged and your eyesight is slowly dimming down. Your vision is slowly dimming down. That is very dangerous. And one more condition which is very alarming is, it is not slowly coming down. One fine night you sleep, in the morning you get up, you don't see anything. That is sudden blindness. Sudden blindness is also one of the important conditions with high diabetes. When your sugar levels are very high, sudden blindness can occur. This is a dangerous situation where the ophthalmologist deals with it. But you can reverse it, but the only thing is, don't land up in that situation. No reverse is complete reversal. So once your eyesight is reduced, even if they restore it, there is some problem. There will be a problem in future also. So please be cautious about your eyes. Sudden blindness is a condition which can occur in high sugar levels. And one more important thing, which I am concerned, intensive care specialist, I am an intensive care, is diabetes clubbed with infection. In females with urinary tract infection and high sugar levels, they can land. In males, some other if not urine infection, some other infection like fever, throat infection, etc. with high sugars, they can land in one condition called diabetic ketoacidosis. Diabetic ketoacidosis is a condition where the patient will have some fever or some other infection with high sugar levels and completely dehydrated, semi-conscious or unconscious, and his breathing will be odd, difficulty to breathe, and his oxygen saturation is falling, his BP is also falling. These are the situations. They come to the they are admitted in intensive care units, and they are treated very rigorously with antibiotics, insulin, salines, etc., oxygen. Not only that, some people may go on to ventilator also, and we have seen casualties in this situation, in some uneventualities in this particular diabetic ketoacidosis condition. So please see that diabetic ketoacidosis is a dangerous problem, and this happens only in high sugar levels, patients with diabetes, uncontrolled diabetes, and along with clubbed infection. So this is another dangerous condition which can happen to the patients. Not suddenly. This doesn't take much time. Once infection comes, sugar levels are high, both are clubbed, you will land in diabetic ketoacidosis, which is dangerous. So you have to get admitted in ICU, and treatment is also cumbersome. So please, all these things you can prevent with a small glucometer. Glucometer is the small instrument which is used to check your sugars. You can have at home. It's a very cheaper device. Every medical shop is nowadays having, they are selling this. So please monitor your blood sugar levels every week. Even BP you can monitor. So many BP monitors are available. Small machines are available nowadays. Very easy to monitor nowadays at home. Everything at home. BP, sugar, these two things if you can monitor at home, you don't need to go to hospital frequently. Very rarely, in rare circumstances, you may have to go to hospital. These two are very important. Most important is your sugar, your BP. Particularly your sugar levels. BP, you will know some symptoms will be there, but sugar, there are no symptoms. That's why please be cautious. And one more thing is, in my previous videos, in my video introduction, first video, second video, third video of me about 3 weeks back, how I have given clear picture of how I got rid of diabetes, because diabetes is a disease which is completely reversible. It is a lifestyle disorder. It gets completely reversible. How I got rid of diabetes have clearly demonstrated. Try to go through those first introduction video, second video, and third video of mine, so that you can reverse the diabetes also. But that may take some time, and you may take some. But first thing is, please control your diabetes with glucometer. Glucometer is a must at home. It must be very handy. It's always working condition. It should be with you. That is my request. Always.